Medic 1, you are called to Lois Hills High School for a possible hemorrhage.
Possible hemorrhage.
Yes.
Okay. Arriving at the scene, I would put on my PPE. I would put on gloves, mask, and a gown. Is the scene safe?
Yes.
Okay. What do I see when I get there?
So upon arrival, you are escorted by the principal to the girls' restroom, where you find a teacher sitting on the floor holding a crying 14-year-old girl, while a second teacher holds a bloody towel over a wound to the girl's left wrist. There's a broken piece of glass lying on the floor covered in blood. You observe approximately 300 milliliters of bright red blood on your floor. The teacher is holding pressure and informs you that the girl was found about 10 minutes prior to your arrival by a classmate. There's approximately a 3-inch laceration over the teenager's left wrist.
Okay. I would advise my partner to take over on applying pressure at this time. Do I note that I only have one patient?
Yes.
Okay. I'm going to call ALS on this one. I don't deem a need for a C-spine at this time. My general impression of the patient is that she appears to have a wound on her arm. Maybe it was self-inflicted. I'm unsure at this time. Does the patient appear to be responsive or conscious?
Responsive and answers questions appropriately.
Okay. So apparently, I would assume the chief complaint of this patient is that she's currently bleeding profusely. Assessing the patient's airway, if she's communicative, I'm going to assume it's patent, but I'm going to check anyways.
And yep, it's patent.
Okay. Do I see adequate chest rise and fall in the patient?
Yes.
Okay. Listening for lung sounds, what do I hear?
Clear bilaterally.
Bilateral?
Yep.
Okay. Okay. I don't deem any need for an adjunct at this time. I'm not going to place the. Oh, if I check the patient's skin.
Pink, warm, and dry.
Pink, warm, and dry. Okay. And then, do I know any other bleeding aside from the arm itself?
Aside from just the cut, no.
Correct. Okay. I'm going to have my assistant begin wrapping it to help with the bleeding. Checking the radial pulse of the patient.
Radial pulse is rapid and strong.
Rapid and strong. Okay. Okay. Okay, so I'm going to call. I already called ALS on this. This is going to be a rapid transport patient. So I want to get a set of baseline vitals. So I believe I already have the lung sounds. What is her pulse?
Pulse is 104.
104. Okay. And her SpO2?
SpO2 is 98% on room air.
98%. Okay.
Yes. Yep.
And her pupils?
Pearl.
Pearl. Okay. Okay. If I begin, I'm gonna now attempt to get a sample history from the patient. If I ask her what happened or what led to this.
She had a breakup with her boyfriend at lunch.
Okay. So this was self-inflicted?
Yes.
Okay. Does she have any allergies or is she currently on any medications?
No allergies, and she's on Prozac for depression.
Depression. Okay. When was the last oral intake?
Lunch about an hour ago.
Okay. Does she have any other history, pertinent medical history I should know about?
Just the depression.
Just the depression. Okay. So I'm going to begin my secondary assessment at this time. If I begin palpating her scalp, ears, and face.
No noted injuries.
Okay. And you already said her eyes were pearl. Anything in her airway? I can't imagine there is, but just checking anyways.
No.
Okay. Moving down to her neck, do I see any JVD or tracheal shift?
No.
In her spine?
It's good.
Okay. Okay. So checking her her chest. If I begin palpating.
You're good.
Okay. And oscillating her chest.
They're clear by laterally.
Okay. Moving down to her, checking her pelvis. Oh yes. Oh, sorry. First her abdomen.
Okay. Abdomen soft and non-tender, all four quadrants.
Okay. Then palpating her pelvis.
Stable and no genitalia injuries.
Okay. Now checking if I begin palpating her lower extremities.
There's PMS present on all four extremities. No other injuries or found.
Okay. Going up to her upper extremities. Aside from the bleeding, palpating, do I notice any other injuries or any sort of tenderness?
No.
Okay. Does she appear to have motor function in both of her arms?
Yes.
Yes. Okay. So checking her backside and posterior.
No injuries noted.
Okay. So I don't notice any secondary wounds on the patient, just the current one on the right arm.
Yes. Yep.
Okay. So we're taking care of that. We're going to transport. Within 5 minutes of transport, I want to do a reassessment and I want to get her vitals again, starting with her pulse.
Pulse is 98 beats per minute.
Okay. Are her pupils still pearl?
Yes.
Okay. Her respirations?
16.
16. Okay. I would also want to put the patient on some high flow O2. Do I notice a change in her SpO2 level?
No.
Actually, we'll go with low flow then. Through a nasal cannula, we'll go 3 milliliters, 2 milliliters, 2 milliliters. Are her lung sounds the same as well?
Yes.
And her blood pressure?
110/70.
110/70. Okay. I think that's it.